The main question is how does the adaptive force, which is a specific kind of neuromuscular function, behave in the course of long COVID. Meanwhile, we have seen more than 30 patients with long COVID, and we see the range of ages of them. It goes from 12 years up to 70 years, so we can see it's not a question of age. And our method, we did measurements of the adaptive force. What it is, I will explain later, of the elbow, and as well as the flexors measured by a specific handheld device. Until now, we have 9 patients recovered, and these 9 patients are on the focus in this talk. But it doesn't go about a specific kind of treatment right now, only about what does the adaptive force does in the course of long COVID. On the top you have our schedule. Everybody knows what long COVID means, and we have a lot of people. For Germany is projected 500,000 people suffering from long COVID in the next future, and after 1 year we still have at least one symptom, and it is regardless the intensity, the severity of the infection. Okay, this is a collection of the symptoms. Our just 9 subjects reported. We had sensory perceptions, as you can see, a lot of different kinds, difficulties in concentration, fatigue and crashes, pain, a lot of different pain, autonomous dysfunctions, problems with the immune system, and last but not least, a weakness, and the latter is in our focus today, especially the powerlessness that most of the patients feel. Okay, that leads us to the idea we have about the adaptive force. Each of us does it every day, for instance like this, to absorb the own body weight during walking, downstairs or on the ground, needs adaptation to the weight, so it needs adaptive motor control. And another example is this one. When we are skiing downhill, we always try to keep the position despite the hits coming from the ground, and this specific neuromotor function we called adaptive force. We were surprised that this kind of motor function wasn't mentioned in the textbook of motor science so far, and so we gave it this term, and this is our definition. It means it reflects the capability of the neuromuscular system to adapt adequately to external forces with the intention of maintaining a given position. Okay, how can we measure it? I give an idea how we can do it. Imagine you have a bucket, an empty bucket, and you hold it this way, and then the bucket will fill up with water continuously, and then will be a point when the weight overwhelms your force. Okay, this is that means adaptive force comprises 2 phases. Firstly, we have a holding isometric phase with increasing force, and subsequently there is an eccentric phase. Okay, how can we measure it? There was no device to measure it adequately, so we began to construct devices and made some research with it, and to get an idea how to determine the different data. We can look at this one. On the top we have the force development, and on the bottom we have the angle of the limb. And firstly, we have the isometric phase during the increasing force. And there is one point, the limb begins to yield. And this is the start of the eccentric phase. And this transition marks the point of the switch from isometric to eccentric. It's interesting to see that the force is increasing furthermore during the eccentric phase. So it's important to understand the muscle lengthens, but increases the force. Okay, and there is a most important point for us. This is the point when our holding capacity is at the maximum. Okay, in this case, this was a healthy subject. We had 80% of the maximum. Okay, we introduced the term of adaptive force with a number of publications, basic research, but also applied research. For clinical practice, these measurements are not suitable. In clinical practice, we have to be quickly and flexible, and so we use manual muscle tests, but there is a reasonable criticism of manual muscle tests because they are subjective. That's why we constructed a specific device, a wireless dynamometer, and this detects the force, but at the same time the position of the limb. I'd like to demonstrate how the device is used during the manual muscle test. This subject here has a very stable pectoralis muscle, and I hope we will see I increase my force against the arm, but the arm stays stable during all the course of force. Okay, it's limited by my impact to the arm, but to this maximum, the arm is stable, and the measurement looks like this. We have, again, the force development, and more important is the behavior of the limb. And as we can see here, the gyrometer signal oscillates around the 0 line, and that means the arm stays stable over the whole course. Okay, this one, the left pectoralis muscle in this subject was unstable actually, and it looks like this. During the increase of force, there is a point the muscle starts to lengthen. And this we can see in the measurement graphs. The force is very similar, force development, but there is one point in the position of the arm, or in this case of the thigh, the muscle starts to lengthen, and this marks the maximum holding capacity, and in this case we have around 50%. So we have a half intensity or force compared to the maximum. That's really substantially. Okay, what does it mean from another point of view? A muscle that yields at 50% of maximum means instability. And this could be an alternative approach to understand a number of orthopedic conditions. Okay, coming back to our 9 subjects which recovered meanwhile. This is the duration of long COVID until the measurements in our practice in weeks, and it ranges up to 75 weeks of suffering for a lot of symptoms, and in most cases there are young ladies, or mainly ladies, and this is very hard to be 1 or 2 years at home, and you are not able to do anything. Okay, we measured the adaptive force in these 9 subjects at the following time points. Firstly, before the first treatment, the pre-measurement during the long COVID state. Secondly, the post-measurement means immediately after the first treatment. And the third, after recovery. Okay, 3 time points. At each time point, we measured each muscle 3 times for hip flexors and as well as elbow flexors. Okay, I'd like to demonstrate one example, one patient. The 3 pre-measurements here, the force is quite similar, and in all cases we have nearly exactly the same point of yielding, and this is at a substantially low level of strength or force. So we, in comparison to the maximum, at this weak state, the muscle is nevertheless able to produce a full force, but during eccentric releasing. In this subject, the muscle starts at around 30% of its capacity to yield. The post-measurement, after one treatment, there was one measurement, it was not so stable, but we can see here during the whole course of force production, the muscle were able to stand stable, and so we have a muscle stability up to 100% of force production. And the same applies for the measurements of the third measurement at the end after recovery. Okay, this is a comparison in one picture, the 3 points in the same patient. The red line shows again the conditions under the unstable muscle conditions during long COVID, and the others after treatment. So we can see the holding capacity of the same muscle grew up to 3 times higher after the treatment. Okay, let's have a look at the total statistics. This statistics shows the maximal reach force during the measurement, and as we can see, even under long COVID conditions, the patients were able to activate the full maximal force in elbow flexors as well and in hip flexors. So we can say the maximal adaptive force does not differ significantly between the 3 time points. But more interesting is the behavior of the maximum holding capacity, which we call maximal holding isometric adaptive force, AF isomax. And the red columns show the relation to the holding capacity after treatment. And this looks quite substantially. And the total statistics shows the same. So we have a significantly reduced maximum holding capacity during long COVID compared to the other time points. The same shows this picture. We have the ratio between AF isomax, the maximum holding capacity, to AF max during the same measurement. And we have the same picture, a substantially reduced holding capacity during long COVID. And this is again the statistics overall, and highly significant. In long COVID state, averagely we have only a half of the maximum force available for holding. Okay, Coming to the conclusions, what follows out of these results? Firstly, the maximal holding capacity might be a possible sensitive biomarker of motor control in long COVID. In contrast, the maximum AF does not react. And thirdly, that's interesting too, AF isomax changes instantaneously after treatment, maybe during treatment. We have an instant reaction, and maybe this suggests that long COVID could be based, at least partly, on a functional response on the level of the nervous system. And secondly, this behavior could be used to find an appropriate treatment on an individual level. That's all I have to present today. Thank you very much.
So, thank you, Frank. Are there any questions?
No questions.
No, there's 2 questions. I will start here. It's not okay.
That's exactly what I try to say. What kind of patient? I didn't understand.
Mit Steroiden.
Why not? Yes, there is. Yeah, okay. There is a big advantage to work this way, because you have an immediate answer of the muscle reaction. So you can check out what is for a given individual patient the best treatment. And we have not so much experience with this kind of patients, but we can try it out. There is no common rule. We have this is what we learned over the last months. Each patient is very, very individual with a lot of factors, and you have to fit your treatment on this individuality. And the instant reaction of the muscles can show you the way how to do the best.
So probably you could try to give steroids and then look what the adaptive force, the holding capacity is, if it's increased. Okay, another question?
I wondered if the release point was associated with pain. Do the patients let go because the muscle hurts?
Okay. In case there is a pain during muscle test, you cannot use this result. It's ruled out. We only check muscles without pain during the test.